Dr. Marlene Moretti is a psychologist, professor in the Department of Psychology at Simon Fraser University in British Columbia, Canada. She is a prominent researcher with CIHR funding and a very respected colleague of ours at SFU, where I actually had the advantage of going to graduate school. She has a keen interest in adolescence and developmental psychopathology. Her research focuses on the importance of parent-adolescent attachment as a determinant of mental health and social well-being. She currently leads a multi-site Canadian Institutes of Health research program of research on adolescent gender and aggression, and has published extensively in the fields of developmental psychopathology, social clinical psychology, and intervention. Dr. Moretti serves on a number of government committees promoting the development, training, and delivery of effective intervention and advancing mental health policies to support youth and their families. She has an excellent book that is one of the books available here on the table, Girls and Aggression, Contributing Factors and Intervention Principles. She's also co-written many other excellent contributions in peer-reviewed journals and some chapters that are listed here as well. Her CIHR research is sort of cutting edge on childhood aggression and families, so I'd like to welcome her.
Thank you. Thanks. I don't need that. Thanks very much. It's an honor to be here, and it's definitely an honor to speak after Irwin, and it's challenging, but I will try to move us through some of the research that we have that really looks at adolescent aggression as a developmental issue and as a family issue. To start with, I guess I can use this. I should tell you that technology I'm not very good at, but let's see if I can get this to go. Page down? Okay. Page up, page down. Oh, there we go. So when I think about aggression, and one of the things that we really heard about in the previous talk is that aggression isn't something that drops out of thin air, and we really need to look at what the early roots of aggression are. We need a developmental perspective, and developmental psychopathology emphasizes that we look at typical development and we look at atypical development. And my view is that when we look at both of those, we can start to understand what is it that children are learning or not learning that leads them to become involved in aggressive behavior. You know, I think what was really powerful about the last talk is that, we heard a personal story. And what happens in families is that children are exposed to many, many stories through events, and these become embedded in how they approach life and how they approach relationships in particular, at levels that they are not even aware of. And so the research I'm going to present to you is empirically based research, but it tries to get at some of that issue. What is it that children are learning? And in particular, what I'm going to talk about is what are the lessons that they might learn from both their mothers and their fathers when they're exposed to family violence. As you'll see, there's been very little, almost no research done on exposure to maternal partner violence and its effect on children, and so I'll present some research on that. When Irwin was talking, she was emphasizing issues of love and connection, and another way that we have looked at this in psychology is through the lens of attachment. And I will talk about how attachment might give us perspective in understanding the use of aggression in relationships, and how in fact it might tell us something about the functional value of anger and aggression and how it goes from being functional to how it becomes dysfunctional. And then what are the sex differences that we see in that? Because there are very large sex differences that are emerging both in adolescence and in the adult literature that I think are really important for intervention. And then finally, how can we take some of this and weave it into an intervention which can be disseminated broadly and is cost-effective in at least reducing risk. And I'm pressing the down button. Oh, there we go. Whoa, pressed it too many times. So just to start then, the importance of understanding aggression from a normative perspective. Fonagy, who's done a lot of research in this area and very interesting work, makes this statement which I really find helpful. The answer to the riddle of how individuals can lose restraint over their propensity to injure others must lie in what is ordinary rather than what is extraordinary, normal human development. And so it really brings us back to all of us have engaged in aggressive behavior. Everyone in this room at some point in your lives have done that. And so we need to go back to normal human development and how this is anger and aggression is used in that context to then see how does it kind of go off the rails. And I'm obviously not very skilled at this button pressing thing, but there we go. And so when we start talking about aggression and what are the roots of aggression, it would seem ridiculous to start with this beautiful girl, little girl, or any beautiful small child and think about aggressive behavior. But actually, there's great value in going back to that because what the research shows us is that, and any of you who have young children or have had children will know this too, is that aggressive behavior actually peaks at around 2 years old. And these include things like hitting, biting, slapping, all of those types of things. And when you look at those two top lines, the dark blue one and then the one that's just below it, that's for girls and boys who sometimes engage in those behaviors. So both girls and boys actually engage in a fair amount of aggressive behavior very early in life. You have a much smaller percentage of girls and boys who do that frequently, but most kids are doing this. And what you quickly see is that there's a steep decline in that behavior. Now, what isn't plotted here, and this is the research that's actually coming out of Canada. By the way, you can ride elevators in Canada. Men don't flatten up against the walls, or at least I've never seen that. So it's not quite as scary a place as some might think. At least so far, I haven't had that experience. So what you don't see plotted here is that at the same time that you get this decrease in physical aggressive behavior, you're actually getting an increase in what's called relational or social aggression. So kids are stopping hitting and biting and things, but they're actually starting to learn some other strategies of aggressive behavior. And little girls, because verbal development is faster in little girls, do this more quickly. And so you can identify them as early as preschool, and this is you're off my list for my party kind of behavior, right? Very, very hurtful behavior. So we see that for both boys and girls, you get the rise in relational or social aggression, decrease in this physical aggression. But not all children actually make that transition. What we see is that, so we have at the very bottom there, 17% of kids never were aggressive, continue on not to be aggressive all the way to 15 years of age. And then there are what we call our low desisters. They start off low in aggressive behavior, 52% of the population, and then they go right down to almost nothing. And then we have our high desisters, so they're fairly high when they're at age 6, but they too learn to inhibit. And it's only this very small percentage, this 2%, that actually don't seem to be able to learn how to inhibit. And so the question then becomes not necessarily how do people become aggressive only, but why is it or how is it that they don't learn to inhibit aggression? What's happening in the family? And I think that what happens is that they don't learn things they need to learn in terms of alternate strategies to deal with frustration. They don't learn how to emotionally regulate. And then they may learn something else as well. They may learn things about the functional value of using aggression in relationships. But let me walk you through some of the research that we've been involved in. If I can, I think maybe if I aim it this way, right? There we go. And so, in fact, I just said this. And so we're going to look at what are the family contexts that contribute to children learning to use aggression strategically, not learning to inhibit aggressive behavior, and are there sex differences in these family effects. This is an excellent review of the literature on exposure to what I'm calling interparental violence. I guess you can call it partner violence, whatever you want to call it. It's a meta-analysis of 118 studies. And basically, it shows conclusively that exposure to moms and dads or partners physically being aggressive to each other, that's where you get the strongest effects, is related to increased physical aggression in kids. When you look at that research, there is virtually no studies that have examined whether these effects are sex-specific. So that means, do daughters learn from mothers and fathers learn from sons? Right? Or is it a general type of effect? What are we seeing in that way? And Tanya, you mentioned a couple of new studies that have just come out on this, so I think, and you're going to be speaking about those too? Oh, okay. Okay. So I think we're just starting to see people exploring this, and I think it's going to be very important, not only for understanding, but for shaping interventions. And I'm particularly interested in adolescence because we know now that adolescence is a period of tremendous growth and opportunity. Neurological development in adolescence, they're now starting to believe, is on par with early childhood before 2 years old. You get a growth in neurological development and a pruning that occurs. And you also get, kids starting to move outside of the family and now pursue romantic relationships, close friendships, and so that whole social realm of functioning now is just blown apart. It's huge, and so it means that there are opportunities there for even kids who've been exposed early to difficult situations to turn in another direction. There are opportunities for those kids to lock in, and so I'm really interested in that. In a study that we published recently in aggressive behavior, we looked at, and all the research that I've been involved in is looking at the highest risk kids, and I'm interested in those kids because those kids are the ones, okay, take that. Okay, is that better? Okay. I'm interested in those kids because these are the ones who, in terms of health costs, really account for the bulk of our expenses. These are the kids who are the highest risk to go on and have families like the ones that they've come from. And so as I talk about this, and I was just listening to Dawn talking about, I will try to be careful not to generalize to the population at large. Keep in mind I'm talking about a very, thin slice, clinical slice of the population. This is 112 adolescents who are either incarcerated or in what we have as a provincial facility in British Columbia for serious conduct disorder. So these are the most aggressive kids who have essentially burnt out all of the resources in their communities and are sent to this resource center. And we looked at their exposure to maternal versus paternal partner physical aggression using CTS type items. And then we looked at kids' reports of how physically aggressive they are with their moms and dads, with their peers, and with their romantic partners. First of all, what's very interesting, and this is not the only study to show this, is that girls, at least in this slice of the population, often report exposure to more family violence. And I think there's partially a selection factor in that. I think it's partially, there's some evidence suggesting that girls might move into those situations interpersonally, boys might move out of those situations. At any rate, we find that girls are reporting higher exposure to both moms and dads' partner violence than our boys. And that regardless, though, that although the mean levels differ for girls and boys, they report that IPV is perpetrated to the same degree by their mothers and fathers. So that's interesting in that regard. Oops. And this is then looking at boys and girls and how aggressive they are towards their mothers and fathers. Even though it looks like girls are more aggressive with their moms in their relationship, physically aggressive, that's not a significant difference. Clinically, I'll say, however, it's often the case that these girls who are involved in physical aggression in the family, it's with their moms that this is really the most intense relationship. Now, the sex difference we find is that boys are more physically aggressive towards their friends and girls are more physically aggressive towards their romantic partners. And that is a finding that we heard about in many talks, that you do get that sex difference with the romantic partners being particularly a problem for girls. This is using structural equation modeling, which I will not bore you with all of the details, except to say that extremely difficult to find what we would say pure samples of boys and girls who are exposed only to one type of family violence. So this statistically controls simultaneously for those relationships. And when we look at aggression towards peers, what we find is that it looks like there's a sex-specific kind of relationship going on, which is that for boys who are exposed to their fathers being aggressive to his partner, they're more aggressive with their peers. And for girls who are exposed to their mothers being aggressive to her partner, they're more aggressive with their peers. And so you seem to find some sort of a sex-specific modeling effect there. But this is what's really interesting, is that when you look at their romantic relationships and where is the action happening, it's looking that mom's aggression to her partner plays a special role in how both boys and girls then are aggressive in their relationships with their partners. So you get that path significant from exposure to moms being aggressive to the partner, and both boys and girls being more aggressive in their relationships with their romantic partners, and only from exposure to dads being aggressive to their sons. And so what that makes you think is that moms may play a particularly important role in modeling aggression in close, intimate relationships, and how it is that one manages conflict in that context. I want to just open it up a bit and talk about other types of adversity that these kids experience, because it's not just, as all of you know who work with these families, it's not just watching moms and dads being aggressive to each other. And this was talked about a little bit earlier in terms of rates of child maltreatment. In that study I just presented, we controlled for physical maltreatment to look at the effects of IPV separately. This looks just at the rates, and this is documented in these kids' social histories. We have self-reports, and those self-reports show exposure to be much, much higher across all of these domains. So these kids are experiencing an enormous amount of neglect. Girls in particular are experiencing sexual abuse, although I'll say that clinically, I know that the sexual abuse rates reported by boys are really an underestimation of what's really going on, because I've encountered cases where there's clear sexual abuse and it's just not framed as sexual abuse, right? It's not framed in the system, it's not framed by the boy in that way. High rates of physical abuse. Emotional abuse, how can you have physical abuse and not have emotional abuse? I mean, it's inherently one is, involved in the other. And so when you don't see it very high in the social histories, what it means is we don't really know what to count, when we count emotional abuse. So there's an enormous amount of adversity in that way. And then there's other types of violence that are happening in these kids' lives. And so when you look at violent trauma, 20% and 13% of these, 20% of the girls, 13% of the boys have watched a violent death. And we have partners in Virginia doing longitudinal research with us. And I can tell you that the rates of violent death and exposure to people using guns and things actually is much higher in the US. So we're getting higher rates there. So this is in Canada where men don't put themselves against the wall in elevators, and we're not allowed to carry guns either. And you do get still, a lot of exposure to this type of thing. Death of someone close to them, being attacked with a weapon, and then particularly for boys, being in car accidents. So there's a lot of trauma that's occurring in their lives. And then one of the things, a theme that has gone through many of the talks while we've been here, is really the transgenerational history of the whole issue of violence. And when we look at the social histories and we look at mother's mental health, she frequently has been a victim of abuse for both boys and girls. History of drug use, history of alcohol use, history of mental illness, history of criminal involvement. There's new research showing that maternal criminal involvement is actually a better predictor of child antisocial behavior than is paternal criminal behavior. So it's very interesting. And then, when we look at the dads, also, this profile of a victim of abuse, lots of history of drug use, particularly high rates of alcohol use, mental illness, a lot of involvement in the criminal system. And so this is the lives that these individuals that we're working with live. And we need a way of understanding what does this do when you grow up in an environment like this. And so just to summarize, these kids are not learning how to inhibit aggression and violence. They're not learning how to use other strategies that are going to be in their best interests. And they're not learning how to regulate arousal, emotional arousal, intense emotional arousal. And this is just critical. And they're learning that aggression, violence, and attachment is actually intimately connected. And so when we heard earlier that when you walk into a room and someone goes right for that person, that is the kiss of death, this is something that is familiar for them. This is something they're learning at a level that they don't know and they can't tell you, but that we need to find out. And I believe what they're learning is that aggression and violence has a functional role in those relationships, that it actually works for them, and that we need to understand that functional role if we're going to move people in a different direction. This has been emphasized in many talks, which is that it just tells us the fact that when you look at violence, it is almost always in the context of close relationships. And so this is from the investigation of Juvenile Statistics Bureau, 1997. It's a bit dated, but what it shows is that for boys and girls convicted of homicide, almost exclusively for the girls, this has been towards a close family member or a partner or a child, right? And it's almost always true for boys too, although you see a little bit more strangers as the victims for boys, not certainly far below those who are in close relationships. So the lesson learned here is that if we're going to come to an understanding of aggression and violence, we also need one that is interpersonally nested, right, rather than outside of that system. Just some information on what we're seeing in rates of girls' aggression, which is a particular interest in mine, is that those increases predominantly have to do with aggression in the context of close relationships. So aggravated assault with a 24% increase for girls, a 21% decrease for boys, and this is from 1992 to 2001. Simple assault, 66% increase in girls, 18% in boys. And so it's these close relationships. Yes?
Marlene, can you ferret out how much of this is a true increase in the violence by girls versus our increased awareness of it and holding them?
That's something actually that came up yesterday in your talk, Tanya, and it's extremely difficult to tease that apart. In that regard, when we look at self-report data, epidemiological studies that are large studies, and we try to see, are we seeing similar increases? And I think I mentioned that the Surgeon General's report on youth violence reports a nice study looking at that shows a mirror increase in this way. How much of an increase, I think, is very hard to know. But I think, and I think we have reached a tipping point. There's no question that girls, women, are aggressive like boys and like men. And so it's, I don't know that there's much value in saying how much increase has it been. Maybe we need to kind of move on from that. Yes?
I was also wondering with your study, it was similar to a question that came up in an earlier session. It looks like the maternal
That's an excellent question. I don't think we're really going to know until we do normative-based studies to really understand that. You're absolutely right that in these high-risk populations, what you find is you find a lot of single mother families, and you find a fair amount of transition of male partners in and out. Now, the question is, how valid is it to draw conclusions from that? Does it matter that it's not a biological father, male figure, who's perpetrating violence? And I think that's a really important question we have to ask ourselves. Can you still learn important lessons in that context? And I think you can. But that's an excellent point. And as we start to recognize females' involvement, I think that we'll see some great data coming out soon. Oh, I was just going to say, as I was saying, I think we've reached this tipping point, and I'm hoping that we'll move forward from really looking at rates, what types, who's throwing the punch first, to trying to understand what is the etiology. What is an etiology that can actually help us understand both male and female violence, and how can we use that in terms of intervention? And one of the models that I'd like to suggest, and it's not that this is exclusive, I think there's many, many things that come into play in terms of aggressive behavior. But one perspective I think that's helpful is looking at attachment. Many of you would have been familiar with attachment theory. It's really come back in a way with much more empirical support, great data, developmentally, normative data that we have, and now we're starting to understand how does this play a role in atypical development. So attachment is an evolutionarily, thank you, selected regulatory system to ensure survival and reproduction. And all I mean is that it is non-negotiable. It is biologically based. This is some of the earliest behaviors that we see in infants and other non-human species. And when that system is not operating, that child is at risk. And years ago, when Bowlby was first doing research on attachment, they looked at kids who were in orphanages and who were fed, who were changed, but who didn't actually seem to thrive. It was called failure to thrive syndrome. And some of those babies died, right? And it didn't seem that there was a biological cause for that. And we now know that kids who grow up in these very deprived situations suffer a whole spectrum of consequences as a function of that. So Bowlby says for a child to stay in close proximity or in easy communication with someone likely to protect you is the best of all possible insurance policies. And that baby does not differentiate between a functional and a dysfunctional caregiver. That baby is hardwired to make that connection and to pursue it as a life or death issue. This is a drive that supersedes other drives. People will kill for attachment, we know that, right? They'll go without a lot in terms of the importance of attachment. And Bowlby really talked about, as he went on in his career, that it's from cradle to grave. This is not just about babies. This is all the way to when we die. And in fact, people have talked about attachment to people who have died in our lives. That sometimes where there is an event which creates a lot of distress for us, we think about that relationship even though that person is not here. And so it's a psychological relationship. For Bowlby, and I haven't found a theory that offers this kind of an understanding of anger and aggression, and that's why it's particularly appealing for me. Bowlby says that anger is a natural response of the child when the expectation for safety, closeness to the attachment figure is jeopardized, right? So it's a natural response to the situation. And in normal development, in typical healthy families, angry behavior can strengthen the bond between the child and the caregiver because it serves as a signaling function to the caregiver that's very tied to that child's capacity to function, right? So the child is saying, get over here, I need you, I can't manage this situation. and the sensitivity of the caregiver to come in and give that care helps provide the support that that child needs to deal with their stress. And when they do that, when caregivers do that sensitively, the child develops greater autonomy in their capacity to do that themselves. Because in fact, what that caregiver is doing is modeling how do we deal with anxiety and how do we deal with distress. There are other instances of looking at angry behavior as in the service of attachment relationships. So one, if you've ever had children, is when you get very angry at your child for engaging in dangerous behavior, right? Very common, almost immediate response when your kid runs off to the road, right, where there's traffic, is for parents to immediately act on that and give a very angry response to it. And you're communicating to the child, this is dangerous, don't do it again, right? And that's, biologically based, important to survival. Anger toward a romantic partner who appears disinterested, or anger towards the person who may have taken that romantic partner's interest in another direction. And so Bowlby talks about this as another expression of the attachment system. These relationships provoke very strong emotions, the desire to maintain the relationship, and a lot of distress when it's threatened. And so Bowlby concluded that at the right time and to the right degree, anger is not only appropriate, but it may be, in fact, indispensable. It serves to deter from dangerous behavior, to drive off a rival, or to coerce a partner. And in each case, the aim of angry behavior is the same, to protect the relationship, which is very special to that angry person. So that's not to condone aggressive behavior, but it's just to put it in a context that maybe we need to start understanding that behavior being common and that behavior actually having a functional value. When we look at moving to where anger becomes aggression and violence, from function to dysfunction, Bowlby talks about children whose pleas for attention are persistently ignored or rebuffed, or they're abused or maltreated, and that often what you'll get in that situation is the escalation of anger to aggression and then towards violence. And you'll get this in adult relationships as well. And so when there's a rebuff, punishment for the attempt to connect, you often get the escalation in angry behavior to violence. And that often the problem is that it actually elicits a response from the caregiver. It can be a very punitive response, but it elicits a response. And when that happens, children can build even stronger bonds with that caregiver, and couples can build stronger bonds with each other. And what they're learning then in that context is that aggression and violence actually helps. It is the fabric of attachment in that relationship. So Bowlby concludes that the most violently angry and dysfunctional responses are elicited in children and adolescents who are constantly subjected to the threat of being abandoned. And Bowlby has his classic books, which are absolutely wonderful to read. And he talks about some research on adolescents who murdered their parents. And in one case, this boy he put a bomb in her suitcase, his mother's suitcase. And when he was questioned about why he did that, he said, "She'll never leave me again." Right? And it's just very similar to what we see in adults, in romantic relationships where there's problems like that. I want to emphasize that an attachment perspective does not condone violence. And I think we really need to move away from the judgment of whether it's right or wrong or what we should do as a society in terms of retribution and so on. We may need to make those decisions in a separate venue, but we need to understand what are the roots of violence in terms of human development if we're ever going to do anything about prevention and risk reduction. So please understand when I talk about attachment, I'm not talking about, warm, fuzzy, let's give everybody a break kind of things, right? I just want to talk about some of the evidence on the relationship specifically between attachment and aggression and violence. So what are the prototypical attachment patterns of adolescents at high risk for aggressive and violent behavior? What is the relationship of attachment insecurity to aggression? And are there sex differences in those patterns? When we look at attachment, people will say, well, the insecure attachment is a risk, and it's true that there's a lot of evidence that insecure attachment is a risk for aggressive behavior. But we need to go further than that and look at what kind of insecure attachment is a risk and for whom. The fundamental dimensions underlying how we conceptualize attachment are two things: the view of the self and the view of other. So starting with the view of other in child development is, can and does my attachment figure, or as Bowlby says, the person I love and who loves me, can and will they respond effectively to my cues, to them, to support me and to offer protection? And the view of self, which emerges in that relational context, is, am I the kind of person who elicits the benevolence and care of other people in general? And so as children develop, these real interactions with their caregivers become consolidated into a mental or internal working model that guides them in relationships, their expectations of others, and their view of how they see themselves. And in the attachment field, and I'm not going to go into this in depth because you could talk for days about it, but in the attachment field, they talk about 4 quadrants, 3 classic ones, and then there's a 4th that's been differentiated recently. And secure, of course, we're all secure here, so we know what that is, right? Positive view of self, positive view of others. Preoccupied is really a view that if I could get myself to be the kind of person that you need, you could give me what I want, right? So if somehow I can figure that out, or if I can pursue you in a way and I can show you that I have those features, I know that that will be reinforced. And so there's a lot of pursuit and a lot of anxiety in the preoccupied attachment pattern. Fearful is really a negative view of self and a negative view of others, which is that I know if I approach you, all you're going to do is hurt me and punish me, and actually I'm kind of a worthless person anyway. So that's fearful. And then dismissing, which has recently been, well, not recently, I guess probably in the last 20 years or 15 years, has been differentiated as an avoidance style, is the kind of, you know what, I'm okay, I do perfectly fine, and quite frankly, I think people are idiots and I don't need them. I'm checking out of this whole attachment game. And, you know, when we look at adolescents, they may seem often dismissing. Sometimes they're so dismissing that, you know, they're what we call dismissing wannabes. They're in fact not that dismissing. But you do have a segment, a small segment of kids and of individuals who I think practice the deactivation of the attachment system so much and over such a period of time, and maybe there's some biological predispositions, that they actually become effectively dismissing. When we look at clinical high-risk populations, and this is a study of adolescents that we've done in our CIHR, Canadian Institutes of Health Research, not surprisingly, predominantly secure is almost non-existent. And you can tell right away when you get one of these children and says, whoa, what is this child doing here? This is an inappropriate referral. And these are kids with very severe, what we'd call conduct disorder, a lot of aggressive behavior. You know, and often our view of these kids is that they couldn't care less, they're dismissing. In fact, we don't find a lot of dismissing kids. You find more males and females. You also find this distribution of insecurity in adult populations. If you're looking at insecure patterns, more dismissing males than females. And we find more preoccupied females than males, right? And a whole bunch of these fearful kids. When we look at boys and girls and what attachment dimensions seem to be related to their aggression, what we find is that for girls, preoccupied attachment is related both to physical and to relational aggression. So these girls are not backing up. They're pursuing relationships vigorously. They're going to get you to see just how valuable they are and to give them what they need. You know, and we often see that in adult relationships too. In couples, you'll see this insistent pursuit of the partner in this way. And for boys, the degree to which they're dismissing and they back out seems to be related to aggression. So it's a very interesting gender split that we're seeing. Now, Maeslis, who's at the University of Haifa, has talked about the fact that while it would seem that this avoidance would be a good thing and actually related to less aggression, what happens probably is that these kids or these individuals back up, and they're pursued and pursued and pursued. The frustration becomes overwhelming, and they finally blow up. So they have no better capacity to manage the difficult emotions that they're having. But there seems to be this interesting sex difference. These research findings are consistent with Joseph Allen at the University of Virginia, who's done extensive research on attachment and aggression, finding that anxious, preoccupied attachment at age 16 predicted increasing delinquent behavior, including aggression, as they move to late adolescence. In another study, females high in attachment anxiety and low in attachment avoidance, that's basically preoccupied, reported higher rates of perpetrating violence towards their partners. And we have found that dismissing this in males is linked to early behavior problems and increased levels of psychopathy as well. When we look at what's emerging of how do we understand that sex difference, as I said, it looks like female infants, and this is very, very young, I think they're about 2 years old, respond to family violence by moving towards moms, the girls, and the boys towards moving out of that situation. And it may be that there's actually a neurobiological propensity and an evolutionary advantage for females to orient into close relationships by virtue of the fact that they are going to be the caregivers of young infants. And it's advantageous for them to be orienting towards that. Whether or not that's true is hard to say, but that's one of the hypotheses that is out there. So how do we take all of this research then and weave it together and try to do something to reduce risk? And this is something that we've spent a good deal of time working on. There has been a huge growth in attachment-based interventions for young children, and I'm talking up to the age of 5, that reduces aggressive behavior. There's a nice review that's done by Van Isendorn and colleagues where they looked at 70 studies representing 88 intervention effects on parental sensitivity and child attachment security. And those interventions that specifically focus on promoting sensitive parental behavior proved to be effective in changing the child's not only level of security, but also reducing their behavior problems. There is a wonderful program called the Circle of Security. I don't know if some of you have heard of that. And it's shown to have nice, effective results. Some research coming out of Europe with Van Isendorn's group on video feedback intervention to promote positive parenting, again for young infants who have behavior problems, shown to have some very nice effect. Diamond has done attachment-based therapy for adolescent substance use problems. That's one of the only attachment-focused interventions that I know of. And the common focus here is on this parental sensitivity, the awareness of attachment issues as a prerequisite for changing parenting behavior. Part of our desire to go in this direction is that even though parenting programs really work quite well for kids up to about the age of 10 or 11, we know that they're actually not that effective for parents of teenagers. Our view was that, because the kid can just tell you where to put it and walk away, and our view was that, what's going on there has to be more relationally focused. And so we were pushed by the need to fill that gap and also by the promising evidence with these younger focused programs. So we have developed a manualized 10-session group format program that uses a lot of experiential components in the program, such as role plays and reflection exercises. And it's for parents or alternate caregivers, and we will include anyone in that group who has an interest in caring for that child. So that can be biological mom, biological dad, foster parents, step parents, whoever, grandparents, whoever is interested, often separated families as well. And we do what we call a pre-inclusion interview rather than an interview to screen out people. And we're just looking for a window where they have about 10 weeks where they can hold it together to do the program. Parents often have other major mental health issues and substance use, but as long as we can get them in for 10 weeks, we work with them. Because if we wait for those substance use issues to resolve or the mental health issues to resolve, we're lost, right? No one's going to be there. So it really is emphasizing going to them where they are in their lives and offering what intervention we can. We focus on what are the building blocks of secure attachment. And as I said, that's caregiver sensitivity. So this is really the ability to perceive and to interpret the child's behavior in terms of attachment needs, particularly when that behavior is aggressive behavior. It's not an easy thing to do. So when the person's getting upset with you, to really step back and think, what's going on in terms of the relationship here? Cooperation, which is the ability to time the parenting to actually what's going on for that child. And so often you find that parents of insecurely attached children are rushing in quickly, too quickly, and without regard to the child's experience. And they're really very ineffective. And so we look at listening to those cues and timing the approach to the child and the support to the child in a way that respects their autonomy and their psychological experience. Mentalizing or reflectivity, which is the capacity to sense and to read human behavior, both in ourselves and others. This has been called other things. You're probably familiar with mindfulness. This is really about mindfulness. And mindfulness that you understand and you try to understand what is the experience of the child, what's my experience in this situation. And through those, what I call dyadic affect regulation, which is being able to modulate at that affective level, to hold and to tolerate and to explore difficult emotions without completely blowing up or without backing up so much that you avoid the whole situation. So caregiver sensitivity, cooperation, this reflectivity, and the regulation, particularly during conflict, is really at the heart of the issue. Not an easy thing to do, particularly for these families. It's extremely challenging. It's challenging for all of us, but for them. So we boil it down into very simple things to try to get them to take steps in that direction. One is identifying what are the attachment and interpersonal needs, and how do I reframe my conflict with my teen from this perspective? How do I reflect on what's going on for this child with empathy? How do I stay available to them and modulate my own arousal even when I'm in the face of conflict? And then I can use all of those wonderful parenting skills that many of these parents have learned in endless parenting groups. It's not so much that they don't know the parenting skills, it's that they don't get the relationship part right? But we certainly support them using those. Each week focuses on a key attachment principle as it relates to adolescent development. We do 1-hour sessions, only 1 hour, and only 10 sessions. There's evidence to suggest that longer intervention programs, particularly from that younger group, actually are not necessarily as effective as the shorter sessions. This is not to say you can't have wraparound things that go with this, like family therapy, whatever, but you really want to keep it structured and focused. So here are a few examples. Attachment is for life. That's one of it. Taking a look at how was it when my child was a baby? How is it now when they're a teen? How can I see the attachment issues in the relationship, because they're really still there, even though they're harder to see in the relationship with the teen. Conflict is part of attachment, which most people and most parents look like, are you kidding me? Conflict is part of attachment. But looking at conflict as an opportunity to actually move the relationship forward and to practice for that child how to modulate their experience and how to build. And empathy, the importance of empathy in terms of growth and change. Many of these parents have come from the same experiences that they're struggling with their child. And for them, it's hard to understand what empathy is, let alone to practice that in their parenting. I'm going to quickly run. How am I doing for time? Oh my God, are you serious? Oh, goodness gracious. How did that happen? 5 minutes? Really? 5 minutes? Man. Okay. All right. So what I'm going to tell you, we had a wait list study. Just keep in mind that these are the kids we're targeting. 50% of them threaten to kill or seriously harm themselves. More than that, threaten to kill or seriously harm someone else. That's what we're targeting. Parents attend, they get this. This is about relationships. These parents want to hang on to these kids even though there's a lot of battering going both ways. This is looking at, we don't get wait lists to treatment start significant decreases. We've done follow-up looking at up to 18 months. We find significant reductions across the board on aggressive behavior, anxiety and depression. We're able to retain those as time goes on. And this is important in terms of, are these changes significant? We are moving kids out of the clinically significant range, which is 70th percentile or above on the child behavior checklist. But let me emphasize, this is not a cure. This is a risk reduction in these difficult families. And we have moved into training people across the province of British Columbia. And we're looking at generalizability because everybody can develop their nice programs in their center. It's another thing to get them to work in the community. This is with 78 adolescents and their caregivers, both males and mothers and fathers and alternate caregivers. The same targeted population. Low dropout rates, pretty good attendance. They're a tough group to get at, but we do a lot to engage them in the beginning. We find significant decreases on verbal and on physical aggression for both boys and girls. And I'm just going to run through these really fast. You know, you just basically get improved perceptions of parenting, decreased caregiver strain, increased satisfaction and a sense of efficacy. You're getting these parents to hang in there with the kids. And this is I like this finding the most, which is that the caregivers are reporting significant decreases in how aggressive they are towards their teen. And that's really what happens, is that this is going all the way around in the family. Of course, the feedback from the parents, they seem to take to it quite well. And these slides, I think, will be available if you want to go through it in more detail. I did have a role play, but I think maybe I will skip that, and I'll have to skip this too, which is what the parents actually say. We're starting research looking at process. What's the process of change? How can we better understand that? And that's a model that I think about when I can't sleep at night, which is basically all of these wonderful process-related things that happen. But I want to emphasize this, is that when we look at interventions to reduce risk in these very difficult families, Never think one intervention, 10 weeks or even 20 weeks or whatever, is going to do it, because when you look at comorbidity, these are our kids done through structured diagnostic interview. The level of comorbid with conduct disorders, substance use disorders, high in both boys and girls. A lot of what we see, I think that Dom was talking about negative affectivity. We see a lot of depression and anxiety in the girls in particular. And when you look at the number, just the number of disorders, very few of these kids come in with only conduct disorder. The majority of them are coming in with multiple disorders, and you really need to consider that. And the girls in particular who end up in this population, I think we're getting about 30% have 4 or more comorbid disorders, right? So by the time they reach us, we really need to not be thinking of a silver bullet. We need to be thinking of a system of care. So intervention needs to be tailored to the complexity and the severity of clinical need. And the greater that is, the deeper it is, the more chronic it is, the more you have to wrap service around this in a really thoughtful way. And I would even go so far as to say that if you don't have the resources to do it, don't go there at all. Because what people learn when you give them a brief intervention and then they relapse is they learn that they're treatment failures. And these families come to us, and that's why it's so difficult to engage them, is they feel so blamed and they feel so inadequate. So, and it's like if somebody has a broken leg, do we expect that they should cope with anything less than an appropriate cast and care? We don't, right? And we need to put the same investment into mental health. And finally, that the components need to be integrated beyond the child. They need to be integrated into the family and into the broader social context. And I'll just end very quickly by acknowledging the funding of the Canadian Institutes of Health Research and the Ministry of Children and Family Development and our various partners and all of the people who've helped us do this work. Thanks very much.